Number one is that one of the things that is a pain point for clients, you may have experienced this yourself, is just how long it takes for one to wait when you go to the clinic. You've got at best a 2-hour wait between triage, being seen by the doctor. Heaven forbid that you should have to go in for, lab tests. That takes extra time. And then for medication. And in this case, the proposition is make a call, speak to a doctor, we will come to you. It means that our customers are not spending time and resources on the road traveling to a clinic. It means that they are not spending time and resources going to take a loved one and then take them to the clinic, which is the other use case, which is the other situation in which people access clinics. It also means that there's the privacy of and the comfort of one's home, and for employers that their employees are not taking time out to go for outpatient healthcare services, which can be delivered to their homes or even can be delivered to their place of work. It also means for employers that where they have to do statutory tests, these tests are delivered to the place of work in terms of sample collection, rather than them having to move their employees to a third-party station, which disrupts productivity, it disrupts production lines, etc. So what we found is, contrary to expectation, in fact, this is not just helpful for people at the kind of top of the market, that is to say bankers, people who are time-starved. But we found that it's at every level, even down to the person who is running a small business, a small kiosk somewhere, because they understand that if they have to leave the kiosk or close their shop and padlock it so that they can go and access healthcare at the local clinic, that is a day of business lost. And so time, whereas, the saying was time is money, literally today we know that time is right up there with oxygen. And so you don't want to spend it unless you must. There's a second thing that we are observing as a result of delivering our services in this way. It is that rather than people undertaking the behavior that Dr. Mocha mentioned, go on to Dr. Google, check and see what it says, and then self-diagnose and self-prescribe, which means that the underlying issue is not dealt with until so much later when the health outcomes are even worse. What we're finding now is that the customers are coming a lot earlier, or they're seeking healthcare a lot earlier. Resultantly, they're able to access better services, better quality with better outcomes. And so both the uptake and the output and the results are much better as a result of us employing this. And of course, the third and most important thing, which is all of us are price sensitive today. We know that nobody wants to have to pay more than what they need to pay for. So the receptionist for the parking lot, etc., they're literally paying for healthcare services. Makes a huge difference to our customers. And we're seeing the uptake not just in the cities and urban areas, but in the cities for those of theirs who are in the rural centers, for people who are in the diaspora, for the people who they love back at home and they want to get healthcare for them, and for those who are in the countryside who do not want to travel for one reason or the other, farmers, small traders, etc.